The MEC for Health in the Eastern Cape, Nomakhosazana Meth, says they've intensified the war against TB in the province. The Eastern Cape government is marking World TB Day at Port Alfred in the Sarah Baartman District. The district is in the top 5 of those with high prevalence of TB in the province.
The Eastern Cape Health Department, together with the Eastern Cape AIDS Council, will today officially commemorate the World TB Day. They are in the Sarah Baartman District, which is said to have some of the high prevalence of TB infections in the province. Well, a lot of people, and there's been a lot of assumptions that this could be because of the closure of specialized TB units and that clinics are now being used to serve that purpose as well, meaning that a lot of people become exposed because there is no separate facility for those who have TB infections. But right now I'm going to speak to the Health MEC in the Eastern Cape to just find out more about this day. A very good afternoon to you, Mel.
Good afternoon to you and your viewers at home.
Let's first talk about today. Obviously you chose the Sarah Baartman District for a reason. Why this particular area?
Let me first say, me and you can end TB, which is our theme for the year. And we also customized it, but we added to say we're celebrating 30 years of democracy. We are here because, as you've correctly said, of the high prevalence of TB, in particular at this area, which is Ndlambe. The issue here, we are still having a low success rate in terms of the 90-90-90, which is now 95-95-95. We are doing well in terms of the first 90s, because already we are above 90 and we are closely approaching the 95-95, but our problem is at the last 90, which is at 78% in terms of the suppression and the outcome of what we would like to see after our patients have been diagnosed, have come to take treatment. Our challenge is loss to follow up. As we speak here at Ndlambe, we've got still a very low rate in terms of success rate at 64%. And the success rate in terms of the loss to follow up, the highest number of the losses to follow up, you find it here in Ndlambe. So we are here to preach this word, to say TB is curable, and we are happy that we are here as we celebrate with the world, with our partners that are reliable, that we've been working with, who are making sure that we get to where we want to go to. We have not achieved what we targeted for this term that we are ending now in 2024, as we ended it in 2023, starting a new term for 2023 to 2028. We're targeting at least a success rate of 50%, and we are almost at 37%. But that success story also is a good story to tell. It's good sometimes to put yourself a target, so that if you don't achieve, at least you must have done well. So the work that we are doing with our partners, our municipalities, as you can see, I'm going with the mayors, both of the district and the local, our civil society, including other government departments, in particular those from the social transformation cluster. We are doing this work together in ensuring that we end this TB come 2030. As you know, it is all of us target as South Africa that by 2030 want to see the suppression, full suppression of HIV and TB. So we are here to do that, conduct awareness, ensure that we go door to door, as we conducted a 4-week program going to door, in particular targeting the young people at schools. And we are happy with the turnout because we were able to interact with about 28,000 people who were able to screen during this program.
ABC, I know that there's one burning issue actually that a lot of people seem to raise, and they attribute the rise in TB infections to that, which is the issue of closure of specialized or specialist hospitals, if I'm correct. Can you elaborate a bit on that? Would you say that there's a link between the rise of TB infection and the closure of these facilities, and of course which results to people having to go to now normal clinics and be with other people who are not infected for them to receive treatment?
Actually, it's opposite of that. It is because of the success that now we are closing the hospitals, because we don't necessarily need to be hospitalized in order for you to be able to end or to suppress successful TB. The regimen that has been introduced from time to time by this government actually is not the rise of TB infection, but it is stubborn to go down. As I said to you, we're targeting 50% suppression or a success rate in terms of trying to make sure that people are cured by 37%, but issues of loss to follow up continue to interrupt from time to time. But it can't be said we are closing because we are giving up, now people are going to clinics. It is something that is deliberate for us because we don't need to be admitted in a hospital in order for you to get treatment. So it is the success story. It is because of the progress that we've made and even making people understand, and even making this issue of the treatment to be not that difficult, because with the number of tablets that people used to take, and now they are taking only 6 tablets with the new regimen. So it shows that South Africa is getting it right. If you can look at the statistics, the long way that we've come from, since 2000, there was a high number, but now the number is going down, but still it is not where we would like to see it. So it is stubborn, but there is success that we are appreciating.
And lastly, MEC, just maybe highlight some of the programs that your department is going to run to ensure that, you obviously preach that people should continue with their TB treatment, and also to try and, lower this rate.
Firstly, the campaigns like this ones, we are not taking the 24th of March as the World TB Day to be the only day. Hence I said we've got sustained programs that we are doing. We were here at Ndlambe for 4 weeks, as I said earlier on, but it's not going to end here now. After we've left from this program, then there's nothing that is happening. Our clinicians are out there in communities. We are working with civil society, as I said, through our Eastern Cape AIDS Council to ensure that it is our daily program to talk to our people, to engage them, to go and look out for those who have been missed in the process, through the loss to follow up. And we are happy with the rate of those that are coming back, because we even adopted or launched a program that said welcome back after the COVID-19, because we're worried about the people who, because they were not now visiting our facilities, they were lost in the process. So we said welcome back, and we launched another program in terms of HIV and AIDS, because the core infection of HIV and AIDS and TB is the one that sometimes leads to fatalities. So we've launched a program that said undetectable, untransmittable. Those are all the programs that we are doing together. Remember, government now has combined the strategy of both TB and HIV AIDS, that you can't do one away from the other one, because they are correlated. So the work that we do, we shall continue to do. Through the NHI, we are focusing on the primary health care, which talks to the outreach program that we are doing, going to the village where people are, and giving them the service that they need. So it's not a matter of an event. And there is a dedicated work that we do, working, of course, with our partners, and we are sure that working together, we can end the TB.
Thank you so much, MEC. That was the Eastern Cape MEC for Health, saying that they have seen quite a great success when it comes to TB treatment, and saying that that is part of the reason why they have closed the hospitals that specialized in TB, and also emphasizing that they have now moved from 90-90-90 program to 95-95-95, which basically means that they are targeting 95% of residents to have been tested for TB, 95% to be receiving their treatment, and hoping for a 95% success rate. Well, we are here, like mentioned, in the Sarah Baartman District, an area that is quite prevalent when it comes to TB cases and TB infections. The MEC says that this is just the beginning of the type of programs that they will be running, and that it will not end here. They'll be reaching out to the community and making sure that people do follow up on the TB treatment, as some of the problems that have been quite a major issue is people deciding to just stop taking treatment the moment they feel that they are better. So they say that they are preaching that people must continue taking their treatment even if they feel a lot better.